probe, we usually start in a specific area because we're following the Dentrix software. So we're always going to be starting on the upper right facial, and we're working our way this way facially, and then we drop to the lingual and work our way this way. Then we're going to drop to the lower right facial and work our way to the lower left, and then go to the lingual and finish on the lower right lingual. So that's always going to be the order that we go in. Now when you pass off, you don't have to, we're going to give you like random areas, so don't worry about which direction you're going in. But when you practice, always practice the direction that you would be going if you were on that tooth, just so you don't work backwards, get used to working backwards. So remember that for now we're going to be fulcruming in the quadrant that we're working in because this is sharp, and so we want to make sure that we're nice and stable. So our get ready zone for the probe, we're going to be inserting on the distal facial line angle of the most posterior tooth. So in this case it would be number 1, but for the sake of demonstration I'm going to show you on tooth number 2. So we're going to make sure that we line up our probe so that we're in contact on the enamel surface of the tooth. So then you're going to gently, making sure that you align the working end of the probe to the long axis of the tooth. And so right now you're in contact, and you're going to gently slide the probe beneath the gum line. And we're going to be using walking strokes with the probe. So our walking strokes are going to be 1 millimeter in length. And we're not going to be removing the probe from the sulcus. So instead of going, I'm going to kind of do this drastically. So instead of going in and out like this, where it could jab the patient, we're going to maintain our probe tip underneath the gingival sulcus. Can you guys see that? Mm-hmm. That way it's not jamming the patient in and out.
You said by like 1 millimeter?
Yeah, so we're sliding it coronally up and down 1 to 2 millimeters, and we're walking horizontally millimeter by millimeter.
Okay.
So we're going to insert here. This is our get ready zone, and we're going to walk distally until we reach the distal contact point. And once we reach this contact, we're going to lean our probe in to get the proximal contact reading. Then we're going to withdraw our probe. We're going to reinsert the same place we started, and we're going to walk our probe across the facial, looking for the deepest reading. Need my loops, y'all. And then as soon as we come to the contact point here where these two teeth touch, we're going to tilt our probe inward to get the proximal reading here. And then we just start all over again. Distal facial line angle, insert it, walk our probe to the distal, to the contact, insert for that angulation, withdraw, reinsert, walk all the way across the facial, go into the mesial contact area, adapt to get the proximal reading, come out, and you're just going to work your way all across the mouth doing the same technique. The most important thing is to make sure that you're adapted to the long axis of the tooth. The most common mistakes I see are people being either too flat, so they're kind of coming in too bluntly and it hurts the tissue. So too blunt meaning you're kind of coming at the tissue at not enough angle, and so
so you have to come in kind of like,
exactly, teeth are kind of more conical, and so you don't want to have to jam to get it under there, or they're being too drastic and they're kicking this elbow out way too far, and you can actually come right in between the teeth like this. So kind of mimicking the long axis of the tooth. The other mistake is pressure. Sometimes people are afraid to apply pressure at all, or they're applying way too much pressure, and you're kind of seeing a lot of blanching going on in these fingertips. Now with a typodont, it's hard to mimic the pressure because these tissues are so rubbery, and so while trying to stay subgingival, you kind of end up applying a bit of pressure. But the way to practice good pressure is to go underneath your fingernail and see what it feels like for that tender tissue underneath your fingernail right there. And that's about what you would need to apply on a human sulcus. So do that for a while until you kind of get a feel of about how much pressure you would need to apply.
we come back with
Everyone's got Band-Aids. So, yeah, so watch your angulation and then just kind of watch your pressure on the probe. So any questions on that? Okay.